Hello, and thank you for taking the time to watch this video. As many of you know, our local region, the nation, and the rest of the world is facing a new health challenge in the viral disease known as COVID-19. My name is Ross Kaufman, and I'm proud to call Bluffton, Ohio my home. I also happen to be an epidemiologist and quantitative data analyst. I received my master's and doctoral training in public health from The Ohio State University with an emphasis in epidemiology. I currently am an assistant professor and director of public health at Ohio Northern University. I also serve as a member of the Allen County Board of Health and on the board of directors at Mennonite Home Communities of Ohio. This past week has brought the challenges ahead for Bluffton and the rest of the nation into sharp focus. On Tuesday, the governor requested that Ohio's colleges and universities transition to online courses. Then on Thursday, he and Ohio's director of health took the step of closing all primary and secondary schools in the state, stating that they believed that over 100,000 infected could already be here in Ohio. Today, Friday, the president called a state of emergency and noted that we face a 40 to 70% infection rate. Despite what you may have heard, COVID-19 is not the seasonal flu. SARS-CoV-2, the virus that causes the disease, spreads faster than the flu. According to our current understanding, we expect each person with COVID-19 to infect between 2 and 3 other people, while on average people with influenza infect 1.3. COVID-19 is also more deadly than the flu, with current studies indicating that it kills about 20 times more of the infected. Additionally, it has a long incubation period. Seemingly healthy people may unintentionally spread the disease broadly because it has the potential for asymptomatic spread. That means the symptoms, like fever, might not show up for days after one is infectious. These things combine to make it an extremely dangerous virus that we ignore at our peril. While I was heartened to see Ohio take stronger, though still I fear insufficient steps recently, I fear we are not currently planning enough for how devastating this disease is. The Washington Post has satellite photos of mass graves being dug in Iran. And in Italy, hospitals are being overrun with the sick. In Italy, no business is open except for pharmacies and grocery stores, something that businesses on Main Street should pay close attention to. Anyone known to have the disease and be outside in Italy faces intentional homicide charges. In the UK, they are tripling staff, and one senior member said it is a nationwide preparation unlike any they've seen in peacetime. How did we get to this point? In Italy, 11 days ago, they had 650 tested and known cases of COVID-19. Their number is currently over 10,000 and growing quickly for the reasons I mentioned earlier. How can just 10,000 sick people in a country of 60 million bring an entire country to a halt? First of all, the infection doubled every 3 days in Italy because they didn't take it as seriously as they should have. When infections spread this quickly, the numbers stack up suddenly after just a few short doubling periods. The good news about COVID-19 is that around 80% of those who are infected appear to experience no or more mild symptoms. The bad news is that the other 20% will require more assistance, likely leading to hospitalization, and about 5% of cases will require a ventilator or other extreme intervention to survive. Such treatment requires hospital beds, often in the ICU, and staff trained to oversee them. Lombardy, the region of Italy hardest hit, has roughly 737 ICU beds. Once the number of people passed that, physicians started to have to make tough choices. The sort of tough choices we might have to make here in Bluffton if we don't bend the infection curve. So we can see how the disease spread in Italy and how it spread in China, and how it is spreading in Europe. And we can use those numbers to look at what an outbreak like the one our president and state health department say is coming to our very own community. The table you see here illustrates the burden of disease we might expect to see in a normal flu season in Bluffton. A normal flu season provides a baseline with which to compare COVID-19. People aged 0 to 19 die from seasonal influenza at a rate of 0.01%, or about 1 in 10,000 cases. Those 20 to 49 die at about twice that rate, or 1 in 5,000 cases. For 50 to 69-year-olds, the rate climbs to 0.6%, or 1 in 167 cases. Our most vulnerable population, those 70 and older, the reason we try to encourage hand washing and sneezing into our elbows all the time, die at a rate of 0.83%, or 1 in 120 cases. In a normal flu season, about 20% of the population gets infected. That means it is statistically unlikely that anyone under the age of 69 dies of the flu in any given year. Such events would be rare. Our vulnerable 70 and older population would be expected to have around 1 extra death each year due to seasonal influenza. Mortality is not the only concern associated with this disease. On the right, you can see the number of people infected in each case and how many need significant medical care. Usually, only about 1% of those getting the flu need hospital care. So in a normal season, you would have 800 to 900 people in town getting the flu, losing some days to work, or not, and infecting others, and 8 or 9 of them in a season needing care. This table shows what would happen if we were to have a bad flu season with mortality rates comparable to those for seasonal influenza. For example, a year where flu vaccines were poorly matched to the circulating strains. Even at a 70% infection rate, the impact of an influenza with these mortality rates would be relatively modest on a population level. Around 1 person under 70 would die, while roughly 4 elders would die. A 70% infected Bluffton population with a normal flu would have 3,068 of us infected, but around 30 of us over the season needing advanced care. Bluffton Hospital has 25 beds. Depending on how long the flu season is, you can see that even in a horrible 70% flu season, happening in a few short months, which would get headlines and be shocking, Bluffton would still have beds and care for flu sufferers and other people needing the ER for non-flu emergencies. We can easily handle a normal flu even at fast-spreading rates. Even if everyone got it at the same time, it is within our capacity to handle. So now, let's look at the same models for Bluffton, but with COVID-19. Based on the numbers we can see from China, Italy, and other European countries, we've gotten the number of deaths you can expect from different age groups for COVID-19. They're higher than for the flu. And for those 70 and older, they're terrifyingly high. We can use those to model how hard Bluffton would be hit. Just recently, on television, the president noted that he expected a 40 to 70% overall infection rate. Mike DeWine and the Ohio Department of Health are expecting similar rates of infection. COVID-19 kills 0.2% of those 0 to 39 years old, which is 20 times the killing rate of a seasonal flu. This means that in a worst-case outbreak, where 70% of the population is infected, we would expect to see about 3 deaths in our village in the under 39 age bracket. As we get older, we are more vulnerable. 6 or 7 deaths would look likely in the 40 to 59 ages. It gets worse above 60. Ages 60 to 69, we can expect 11 deaths in a 70% COVID season, with 21 additional deaths in the 70 to 79 crowd. We would expect to see 35 more dead above 80, as 14.8% of those in this age bracket die. In total, we would project that 78 Bluffton residents will die if the disease spreads unchecked. But that isn't the entire picture or horror of an unchecked 70% rate. With 70% infected, 3,068 Bluffton residents would be sick with COVID throughout the season, which experts roughly think would take place over 3 months. That's 3,000 villagers unable to work in those months. What's even worse, 20% of COVID-19 patients need hospital beds. Instead of the 1% of flu victims who seek ER treatment, we would see 613 Bluffton residents requiring hospitalization. Bluffton Hospital, again, has 25 beds. Keep in mind, this is happening while the rest of the country is facing the same challenge. Transporting patients to Lima or Findlay would not be an option as their facilities face the same onslaught. And if more than 25 residents are needing care at the hospital at any given time, imagine what that does when other residents show up needing care. These are the grim choices Italian doctors are dealing with right now. Without ICU care, the mortality rate jumps up over the 2 to 3% rate that it starts at. It's why the overall death rate in Italy has climbed above 6% for the coronavirus. A lot more than just 78 Bluffton residents could die if the hospital is overrun. Furthermore, even among the younger survivors, lung damage and difficulty breathing after recovery is being reported. So it's important to not just focus on the death rate. We also have to consider that if the beds at Bluffton Hospital are overrun, what happens to patients who need the ER for something other than COVID-19? Okay, you might say, that's the worst case scenario. What if we hold infections to the lower end of our health officials' projections, the 40% number? In that instance, we definitely lose fewer people. Only 45 residents lost over the course of the outbreak. However, again, we could see 1,753 residents infected, unable to work for the 3 to 6 weeks that the virus runs its course, and a still terrifyingly high number of residents seeking hospital care over a relatively short season. In this case, 350 would need access to the 25 beds. Again, even with the lowest projected infection rate, we're looking at overwhelming our medical capabilities in the village. If that sounds scary, it's because it is. It is numbers like these, but for all of Ohio, that likely prompted our governor to pay close attention to his health department and make us one of the first states to shut down schools and ban gatherings of over 100 people to try and start reducing the speed of spread for the virus. Yet using these numbers, it's clear even a 40% rate will not achieve what we need. This final chart models what a 20% infection rate, like the influenza rate seen in an average flu season, would give us. Even with a 20% infection rate, COVID-19 would leave us with 175 people needing care, to the 25 beds in Bluffton. Even if they were staggered across several months, that's still twice as many people as could be handled. We don't see the numbers of people needing care come down into a rate that matches a several-month flu season and our ability to put patients in beds until we get to a 10% spread, where only 11 people would die, 400 to 500 would be infected and deal with post-COVID issues, and 88 would need hospitalized. So how do we fight this? We don't want Bluffton to be in a 70% scenario where over 600 of us will be hospitalized. We don't want to lose over 78 Bluffton residents, with some portion of the 3,000 infected to live with the scars of COVID afterwards. We don't want to end up like Italy, where doctors have to use triage to decide who gets treatment and who doesn't. We would hate to see all our vibrant local businesses shut down like they are in Italy, or people arrested for traveling outside their homes. We're going to have to change so much of what we do to try and delay the spread. Delay it so that people can have a chance to be at the hospital. Delay it so that we can drag it out until a vaccine can be obtained in a year. Delay it so that lives will be saved. This is going to take all of our leaders to answer some tough questions and demand that some of our citizens do more than just what was recommended from above about washing hands. We are Bluffton. We can protect our own if we come together as a community. I am hoping these modeled figures give you an idea of the impact we could see in the next few months. I truly hope things happen that mitigate the spread of COVID, but we can't wait and rely on others when you see the numbers shown here. There's an email list being created that I hope the leaders of Bluffton will join. We're seeking to start a virtual collaboration to problem solve the challenges we face. This group is not looking to replace the advice of local and state health departments and the CDC, but rather to think about how we can complement the efforts of these agencies and best implement their recommendations in our community. This moderated listserv will seek to find solutions to the challenges this pandemic poses. Among the topics to look at are: how will we ensure access to food for our sick or vulnerable neighbors? What will happen to kids who get their lunches from our school and need food? Could we set up an "I'm sick" notification sign so we can track spread? How can we track local spread via provider reporting or patient self-report? How many ventilators do we have, and are there steps we can take now to improve local access? How can we be prepared to respectfully handle the dead in the event of a mass casualty situation? How can we effectively disseminate information to the village? Can we encourage more people to sign up for Nixle? Can we make our own hand sanitizer, as we can't seem to buy any? How do we encourage more hand washing? Can we get posters up in town showing some of these facts to change germ culture? How do we help businesses survive while in this time? Could we set up a list so people who are sick can ask for help? Would it be helpful to get infrared thermometers for all gathering places, as has been done in China? We have amazing people and creative minds. Working together, we can flatten the epidemic curve and save lives. But we cannot wait. Testing in the United States has been woefully behind. We must not take comfort from only 13 confirmed cases in our state while ignoring the message that there are likely more than 100,000 cases among us. When exponential growth is involved, even small differences in when we start taking action can result in dramatic changes. In this theoretical model, moving up action by a single day resulted in a 40% reduction in cumulative cases. In China and South Korea, people are using disposable wooden sticks to call elevators. They are taping out 3-foot boxes for store lines to enforce distancing rules. And in South Korea, they are actually flattening the curve so well, life can go on without the extraordinary action required in China and Italy. We can adopt these ideas to prevent choke points and transmission clusters here in Bluffton and gain better outcomes than other regions. We can look to past epidemics to see the differences that quick action can take. Imagine a world where Bluffton doesn't have the same fatality rates as expected in other parts of the U.S., one where we protect each other. Please join me and others on the moderated Bluffton Pandemic email list at bluffton-pandemic@googlegroups.com. Just send an email and we will get you added. Wash your hands, be safe, stay healthy, and look out for one another.